This is One-on-One. You're looking at Jim Albano, Vice President of Network Management at Horizon Healthcare Innovations, part of Horizon Blue Cross and Blue Shield, New Jersey. Good to see you, Jim.
Good to see you, Steve. Thanks for having me.
You were on our sister program, Caucus, New Jersey, and as part of a larger discussion about, this healthcare discussion never ends, you know, it's complex.
Absolutely.
But I want you to break down for us. The reason I want you to have on One-on-One is we wanted to understand exactly what medical homes are. This issue kept coming up. What is a medical home?
Yeah, and I think that it's really a misunderstood term. We actually did some research, and people thought we were talking about, you know, kind of a nursing home.
Yeah, that's my first instinct.
Yeah. And really what we're trying to say is that the primary care or the family physician is really the quarterback or the individual who should be in charge of, take responsibility, accountability for the patient, and is therefore sort of their home base. That's really where the term kind of...
Give us an example. Break it down.
So, you know, people, I think, generally speaking, have a bond with their family doctor. And our theory, our thinking, and you know, this is not a Horizon idea or a concept. This concept's been around for many years, and I think family physicians have advocated for it for a very long time. But basically, their family physicians would say that they are in the best position to oversee all of the care for a particular patient. And the opportunity for that patient to get some guidance, advice, direction, you know, ask questions and so on. If you have a sort of a holistic view of a patient's situation, you're in the best position to guide them, to give them that advice and so on. So I think that's really the concept that we're trying to advocate for.
When you were with us on Caucus, one of the themes that came up that I want to play out here was technology. Technology is having a huge impact on this entire discussion. What does this have to do, what does technology have to do with that primary care physician being the quarterback, and how does it help, hurt, what?
Technology is huge in this whole thing. And we're not there yet. We have a lot of work to do, but I'll give you a really good example.
You're getting the whole example thing. Right?
That's
exactly.
Right. You know, people have to go out and get diagnostic imaging tests for one reason or another. You know, there's radiation involved in that testing. So if the primary care physician is linked technically with the radiology imaging center that does that test and is feeding back the fact that, you know, you or I had a diagnostic imaging test recently, well, then there's no reason to repeat that kind of test. And in today's world, there are repetitive tests all the time because that coordination, that sharing of data back and forth is not happening on a consistent basis.
And that's why the quarterback's so important. The question is, the other thing I was really curious about is the doctor-patient relationship, okay? This dynamic, first of all, New Jersey different from the rest of the country in terms of this whole role of primary care physician. Is it different from the rest of the country?
Not really, no. It's happening everywhere within the country.
It's got to happen. And the implementation of the Accountable Care Act, how does it change any of this?
Well, I think it supports it. I think the implementation of the Accountable Care Act has the concept of accountable care built right into it, and we talked about that on Caucus, the ACO.
Are you getting, Jim, are most primary care physicians saying, yes, I'm on board, I want to be the quarterback? Because I know that's not easy.
Yeah, it's not, it really isn't.
It's a lot of responsibility.
It's a great point. I would say on a predominant basis, family doctors are all behind this concept.
Because?
Because they see the waste, they see the repetitive testing, they see people going to the emergency room when they don't really need to go to the emergency room. And we want emergency rooms to be for people who really need them. So, that opportunity to improve the experience, improve the quality that a patient experiences, and then ultimately, the idea here is that it all drives down costs because, as we all know, it's very expensive to have a healthcare system where there's repetition, where there's waste.
Okay, but Jim, now all of a sudden, sorry for interrupting, now all of a sudden someone needs a specialist, all right? Because it often happens, you need a specialist. In this model that we're talking about right now, how do you get the specialist, and what role does the QB, the quarterback, play?
The QB should be integral to you getting to the right specialist, should be involved in that selection process. And one of the things that we're doing as a health plan is providing data to the family doctor. So we're analyzing, it's called physician profiling, basically. We're profiling doctors in terms of the type of care that they deliver.
But hold on, Jim.
Sure.
What was and then what is? Because I'm thinking, wasn't that happening before?
Not really, not really. There really was not a referral based on data or hard facts. It was a referral based on the softer, more intangible things. You know, who you went to med school with, who you did your residency with. We're trying to make it more about the quality and the analytics around the data involved in taking care of someone.
And the primary care physician stays intimately involved, even though the specialist is involved? Because I know in the past, sometimes the specialist would then take over the ball and be the quarterback. I'm sorry for the football analogy.
No, it's a great analogy. It's a great way to put it. I think that's exactly what has happened. There would be a handoff from the family doctor to the specialist, and then the family doctor completely lost track of what was going on with that patient. In this model, there's that two-way interaction back and forth between the primary care doctor and the specialist on an ongoing basis.
Finally, before I let you out here, Jim, it is essential that patients understand as much as possible. The whole reason we're doing this whole series on health and medical education is because it is essential that people watching right now get this stuff. Yeah. And it's not easy, right?
No, it's not. It really isn't, and the patient is key. The patient is probably more important than any other factor in this whole equation. The patient has to take some responsibility, has to engage in the whole episode or whatever it is.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. The Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons, P.C., and by Health First New Jersey. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.